Hi, and welcome to Healing Peak Regenerative Medicine's Longevity channel. And today I wanted to go over a case with you guys because it's a great example of how I use many different therapies to get results with people that otherwise really don't have any options for their pain. And so the case is a 70-year-old male who is a landscaper and has no intention of stopping working. He loves what he does and he loves to work. And he came in about a year ago with extremely swollen hands, particularly one hand was waking him up at night repeatedly, over 5 times a night. And he is a vet and went to the VA, and they didn't really have many options for him. And his wife found me online, and so he came in to see, what if anything could help him with his hand pain. And so what was happening is his hand pain would wake him up at nighttime. This burning sensation would happen. He would try to soak the hand to get the pain to go away, and then he would go back to bed, and that would repeatedly happen over and over again. And so we started with some trigger point injections, which are just intramuscular injections in his arm, and that helped a little bit. And we used a scar tissue breaking up technique also that helped a little bit over the carpal tunnel area. And then we started to use prolotherapy. And his arthritis was pretty severe because he uses things that vibrate, like a weed eater or a lawnmower. He's working with his hands all day, with machinery all day. And so that has really exacerbated the nerves in the hand and then also the arthritic issue. And so the idea was to get his hand back to normal so that he could continue his job. So anyway, we used some Prolo and he continued to improve. He had a little bit of issues with arthritis in his neck, and so I actually sent him to Dr. Vern, which is the chiropractor I work with. He's phenomenal, and had him get some adjustments as well. And so after about 6 months, we did probably 2 to 3 Prolo injections, some trigger point injections. He had chiropractic care, and he was about 80% improved. His hand had become about 50% less inflamed than it was when he first came in. The size had dropped about 50%. You could actually start to see the bones in his hand where before you couldn't see the bones at all. And both his hands started to look the same. It was actually pretty incredible to see the inflammation come down. I don't even think he realized how inflamed his hand had been because it had been that way for so long, and he was using it that way for so long. Anyway, we started to do PRP, platelet-rich plasma, because the Prolo had done its job and it really wasn't working as well as it needed to get him the rest of his results to 100%. And so we started using platelet-rich plasma injections after we'd done some screening and made sure that he had the right amount of platelets and good growth factors. And so we draw the blood. We spin it down, we take the growth factors and the platelets, and we inject those into the hand or whatever joint is painful. And we've done that twice. And after the first 2 times, he had significant improvements. He was about 90% better. And so we waited, to see if the rest of it would just sort of clear up on its own. And after about 6 months, it was winter, he came in. His hand starting to wake him up a little bit at nighttime again. And that's very typical of arthritis and cold weather. It starts to kind of flare up during that time. And now we've decided this summer, we did 1 PRP injection this week. He came in, he had a 1 out of 10 pain because he felt like he needed to write something down even though he doesn't really have any pain. His hand doesn't wake him up at all anymore. He's able to do his job. He's able to landscape. He's able to do whatever it is he wants to do. He can make a fist with his hand, which was not possible before, even in the morning. And so it's kind of an incredible story because multiple modalities were used. And by modalities, I mean multiple different types of treatments were used to get him to where he is now. And every single one of them played an important role in his care. But had he gone through the typical route, he would have just continually gotten cortisone injections into his hand, which would have degraded the tissue more, made the arthritis worse, and eventually he wouldn't have been able to work, which really wasn't a possibility. I mean, we're talking then he's applying for disability and not as active. Landscaping is a pretty active job, so he's getting exercise daily and he's staying healthy, and he enjoys it. And so it's a great story or case because it really shows the true depth of different treatments that you can use in order to 100% heal from issues. And then also the fact that he's a much older person that is also getting these kinds of results because he has a healthy lifestyle and his platelets are working really well and his stem cells are working really well in his favor. And so a lot of times we talk about, young people healing really well, but this type of therapy works fantastic for elderly people too. And I wouldn't say that they're very wealthy people or that they have a ton of money to spend on treatments like this, but the treatments have allowed him to continue to make an income, as well as we've been able to space them out in a way that is affordable for him and getting him the treatment that he needs and the improvements that he needs. And he's able to use something called a health savings account, which is tax-free money. Basically, it's a write-off. And so you can put money into a health savings account. And you can use that to spend on massage, acupuncture, prolotherapy, chiropractic, all of those things. So anyway, I just wanted to share that case with you because of number one, his age, and number two, the different types of treatment we use to get him back to a perfect functioning hand. And I think it really exemplifies how well prolotherapy and PRP can work for people. And I don't plan on seeing him anytime soon. We did the PRP injection yesterday because winter's coming. And I wanted to prevent what happened this winter, which I think it will. And that means, I probably won't need to see him again unless he continues to use a lot of equipment that is vibrating his hand that in a year or two may exacerbate the arthritis again. It's possible, but he has management tools and he has some supplements on board to help regulate and decrease chronic inflammation so that doesn't happen even if he is using the machinery he needs to do landscaping. So if you know anyone that has hand pain or arthritic pain and their doctors are telling them there's nothing that can be done, or their doctors are putting them on naltrexone or ibuprofen long-term as management, that's a really unfortunate way to manage pain for the rest of that person's life. Those medications long-term create havoc all over the body and really don't fix the issue or heal up that problem. And so elderly people, there are solutions. These prolotherapy and platelet-rich plasma injections, they work and are super effective, and this person is not going to need cortisone injections, hand surgery, management with ibuprofen, Tylenol, naltrexone, any of those anti-inflammatories. I mean, he's good to go, good as new. So if you know anyone that's suffering from something like that, I'd love to have a chat with them, and they can call my office at 206-899-6000, and they can speak with me or my office manager about how these things work. We'd be more than happy to talk to them. And you can also follow me on Instagram at Dr. Amber Nixon. I post there all the time with case studies and different tidbits about health and how to decrease systemic inflammation or whole body inflammation and what kind of diets to use, and a ton of other informational tidbits. So that's all for today. Hope you have a great weekend, and we'll see you next week.